our 5:30 business meeting of the Douglas County Commission. I just realized that I didn't have my special welcome thing up. Give me just a second here. I don't want to wing this. So we want to welcome everybody to the October 14th Douglas County Board of County Commissioners meeting. We know that some of you are there at the courthouse and some of you may be joining us online, and we just want to pass a bit of information on regarding how we run our meetings on Zoom during this time of social distancing. If visual aids are used during the meeting, the presenter will share the screen and the call. Participants will not be able to view them without a computer, smartphone, or tablet. All participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking and introduce themselves each time they speak. If you have if you have a public comment on the agenda item or under regular public comment, please use the raise your hand function on Zoom. Staff will call on you and unmute you. We ask that speakers give their names and addresses for the minutes. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. The chat function has been disabled. A recording of this meeting will be available on our website after each meeting. Sorry for not having that ready, but boy, it was worth it, wasn't it, to wait for it. So today we have a proclamation that we'll start off with. We have 4 items on our consent agenda, 1 regular agenda item, then we'll do appointments, general public comment, commissioner and administrator miscellaneous, and that will be our meeting. So we'll start with the domestic violence awareness proclamation. Commissioner Geruso, Commissioner Thelman, would you like me to read this, or anybody really want to step up and read this? I'm glad to.
It's all yours, Commissioner Kelly.
Thank you, Commissioner Geruso. Whereas nearly 20 people per minute are physically abused by an intimate partner, 1 in 3 women and 1 in 4 men will be affected by domestic violence. And between 30 to 50% of trans and non-binary folk will experience interpersonal violence in their lifetime. Whereas Douglas County places the utmost value upon the health and welfare of all of its citizens and strives to provide a safer and healthier community. And whereas domestic violence includes verbal, emotional, economic, sexual, and physical abuse, and all forms of abuse can carry long-term physical and mental health implications. And whereas the effects of domestic violence reach far beyond its impacts on survivors and abusers, causing disruption in community schools, places of work and worship, and neighborhoods. And whereas community engagement and recognition of the costs associated with domestic violence have led to innovative partnerships between local government and health and wellness organizations, which can significantly raise awareness of the public health effects of domestic violence. And whereas during October 2020, the Willow Domestic Violence Center works in partnership with local agencies, businesses, organizations, and groups to sponsor and promote Domestic Violence Awareness Month for community-wide attention on survivors and their children, and to promote support of shelters and community programs. Now, therefore, be it resolved that the Board of County Commissioners of Douglas County, Kansas proclaim the month of October 2020 as Domestic Violence Awareness Month in Douglas County, and urges the community to speak out against domestic and sexual violence, urges its citizens to support and assist survivors of its heinous crimes, urges community leaders to hold offenders accountable, to make prevention efforts a priority by hosting events, creating policies at school and work, and supporting and participating in programs designed to reduce and eventually eliminate domestic violence as a societal problem. Adopted this 14th day of October, 2020. I believe we have Will Averill here who would like to say a few words. Will?
Thank you. I just wanted to start by saying what a year it's been for all of us, and it's been for the Willow Domestic Violence Center a time of unprecedented challenges. And so this particular Domestic Violence Awareness Month is really, to my mind, the most important one that I've been around for and I've been a participant in. What we've seen nationally is an increase in domestic violence due to the pandemic. First, stay-at-home orders, which isolated survivors with their abusers, and continued difficulties with group living and complying with public health regulations. And I want to take a moment to thank the county for, first of all, for facilitating, county staff and county commissioners for facilitating the distribution of the CARES money, which allowed ourselves, and I know several other organizations, to do the best we could to keep anyone from having to be without a home during this pandemic, which quintessentially could be a death sentence. Thanks to that funding and thanks to that money, we were able to move all of our survivors who were in shelter in a group living situation, which was untenable, into private apartments and other living arrangements and hotels, and so including getting some of them to homes out of state. It was very helpful to do that, and it really has made a difference. So I wanted to say a huge thank you for that. One project this year that we've done is working with the Kansas University Engineering Department and their SELF program to put together a brochure on the public health costs of domestic violence. We often refer to domestic violence as a strictly personal and family issue, but the effects go far beyond that and cost nationally $8.3 billion a year in lost workplace productivity, sick days, and other costs related to those incidents. We have broken it down to a local level, and I would welcome the opportunity to speak with the commissioners at some point and talk over this document. But what we did find through this is that $1 of shelter funds is the equivalent to $9 of emergency and crisis funds, including first response, including emergency services, including hospital stays, and including courts and housing. So we can make a significant difference going forward in policy through prevention and through education. This Domestic Violence Awareness Month, we are having a series of activities which start with Rachel Louise Snyder, who is an author who's written a book called No Visible Bruises, which we're presenting a conversation with her on Wednesday, October 21st. And then there's a series of panels about varying programs that the Willow does, and also other information is available on willowdvcenter.org/DVAM 2020. So I hope you'll all go take a look at the website, kind of get an idea of what we're doing this year to raise that awareness. And I really hope that we can continue to work on future partnerships and policy, bearing in mind the unique circumstances that survivors of domestic violence and human trafficking face on a regular basis, particularly in light of the current situation. I'd like to close by just saying thank you again, and I really appreciate you taking the time and reading the proclamation.
Thank you, Will. Appreciate that. Well, if you would, I'm just curious, we heard about Willow's large award from, I believe it was the state this year, and I think there was some miscommunication about what that meant. Can you share a little bit about that with us? Do you know what I'm talking about? Is that making some sense?
I'm absolutely familiar with that. I think there is some miscommunication in the way that was presented. Those awards are part of the grant funding packages that we receive on a yearly basis. They seem like they were made out that they were new awards and that it's like we've gotten this massive windfall of funding, when in fact those are grants that is federal funding moved through a state level, which we have counted on for a number of years. And in fact, compared to what we had asked for and how we'd hoped to develop forward, we actually received kind of less than our normal operating budget procedure. So while it gave the appearance of a large windfall, it was actually a slight reduction that we are attempting to kind of compensate for moving forward in order to continue to provide those uninterrupted services, which again are so important in this time during the pandemic.
Thanks, Will. I knew there was some misunderstanding about that, and since we had you here today, I just thought it might be helpful to explain that to the public, because that was unfortunate the way that was presented. It just seemed inaccurate to me, so.
Yeah, it definitely, we had a good chat with Lauren at the Journal World, and the Journal World did print a further explanation of those funds, which is available online if anybody wants to kind of follow how that turned out. But the initial article was much bigger than the retraction, so I appreciate a chance to kind of go over that again.
Thanks, really appreciate all you all are doing out there at the Willow, and all those groups that are working against domestic violence in our community. Commissioners, anything else on this before we move on to our consent agenda? Okay, so we have 4 items on our consent agenda. Commissioners, are there any items that you would like to have removed from the consent agenda?
None for me.
I don't have anything.
Thank you. Sarah monitors the courthouse for us. Sarah, is there anyone at the courthouse who'd like to have a consent agenda item pulled?
We don't have anyone here for that.
Thank you. And Jill, anyone online?
No.
Great. So I'd entertain a motion for consent agenda items 1, 2, 3, and 4.
Move to approve.
Second.
Moved and seconded. All those in favor say aye.
Aye.
Aye. Passes 3-0. Moving on to our regular agenda, and our first and only item is an approval of Tier 1 Crisis Recovery Center total project budget. And this has administration on it, so that must mean it's Sarah.
Thank you, commissioners. I'll kick it off and then I'll turn it over to our wonderful design and construction and owners team, as well as various, some representatives from Burt Nash, if there are questions. Commissioners, it's really my pleasure, and I think this meeting sort of snuck up on me, that today we approve, the total project authorization for the Crisis and Recovery Center. I was just talking to Bob Tryansky, and this has been something the county has been working on for, my first meeting was in 2016. I think Bob's first meetings on this were in 2015. I know Commissioner Thellman was engaged in this effort in 2015 as well. This led to the work that was approved by the voters in 2018 for a 1/4-cent sales tax to approve the work that we're doing here in terms of behavioral health and the behavioral health campus. This last piece is the first piece of the continuum of care in terms of crisis intervention at the campus. The commissioners have already approved the pieces for transitional supportive housing and the cottages for permanent supportive housing, and you had a work session on that last week where we did the overview of that. I want to thank a lot of people on this meeting that have spent a lot of time and energy on this process. At the top of that list is Bob Tryansky and his tremendous work to keep this moving forward against all odds, to make so much progress really that will benefit people in a way that I don't think we really understand yet how beneficial this is going to be. I'd also really like to thank our design team. Chris Cunningham and Walker Douglas have been working on this project. I think when they were still in architecture school, we're probably working on this project. They were working on it, pro bono for a long time, and a lot of help in this process and project that changed fundamentally multiple times. I've never seen an architect team be so patient with meeting with a very diverse group of stakeholders. The owners' meetings on this process with feedback from Burt Nash, the hospital, DECA, Heartland Radac, the county, just patience to negotiate that process and make sure that we have a building here that really will serve our community very well. So, you know, I could go on and on, but I've already clearly probably done more of that than I wanted to. So I'd like to turn it over to Jay to walk the commission through the total project spreadsheet. And then we stand for any questions that the commission might have. Jay?
Thank you, Sarah. Okay, I'm guessing the best way to do this will be to share a screen. So I always struggle and challenge with this. So bear with me for just a moment, please, and I'll get everything pulled up here. No. There it is. Okay. Can everyone see that now? It should be the agenda item report.
Yep, we can.
Okay.
A little bit.
Well, very quickly, I'll go ahead and run to the bottom and run through what I believe the budget sheet is showing us. Last week, we had just received some of these numbers. We actually took bids for the project on October 2nd. So we've been kind of shaking them, making sure that all scopes are covered, all things are in line so that we could put this together and have for you today here for approval. So starting at the top of the project, you're looking at what is construction costs. We believe the project will cost the 7.862212 in total construction cost. That's construction cost only. Total project cost will come further down the road. In review of the bid documents, the bids that were received by Marlan, we had a good coverage. We had multiple bidders on all disciplines, if you will, of the project. So we believe we have a good number here. They vetted it with the various subcontractors, so we believe we're in a good place with that number. In building the total project budget, we come down to owner furniture, fixtures, and equipment. And these pieces are allowances. Many of those worked up with the CM on the project and in consultation with the user groups to be sure that we have allowances to cover these pieces that are owner provided that will be integrated into the project but are not actually part of the construction process or construction costs. That's what you're seeing here, everything from multimedia, video for conferencing, voice and data phones, low voltage cabling to support all those pieces, security systems, that's including access controls, PA systems, which you have many times in healthcare type settings, white noise systems for the open office areas, duress alarms appropriate for throughout the facility. The list kind of continues on down, appliances, on and on and on, which gives us a subtotal of around $1.4 million that you see here for owner FF&E costs. Again, these are pieces that the owner is providing separate from the construction GMP contract. Next item below, in essence, is also soft costs, but these are professional fees, services associated with design and construction, replatting, survey work that was needing to be done, various pieces that have to go to the state, city fees, those kind of things in order to kind of realize the project. So those kind of things are showing up here in this number amount. And then also the final item on that line is a 5% of the value of GMP, which is owner contingency. That's to cover should we come across surprises in the project process. So again, all of these costs are outside of the GMP, but they are part of an overall bigger project budget. When you add up all the owner professional services pieces, that comes up to 1.158408. So that's the subtotal there. This last part in the summary really just takes those three numbers, adds them up to give us a total project budget of $10,429,241, and you can see the various split outs here in terms of what the overall, what percentage of the overall project those kind of various pieces that we just reviewed are. Here's the construction cost, here's those owner FF&E provided items, and you can see where they are. In the end, we believe the best planning would carry us to $10,429,241, and we'll be able to construct a really quality project for those dollars. So with that, I would stand for any questions on the budget summary sheet here.
If I can step in while commissioners are kind of thinking of their questions associated with this, just to thank Jay for, and you might kind of keep it down there, Jay, on that total summary, if you could keep that scrolled down. So as the commission is aware, I mentioned that we have the behavioral health finance capital costs associated with this project. In addition to this, Douglas County has received $750,000 annually from the state of Kansas to help support the work of the crisis center. It can be either used to offset the cost of the bonds that we will pay each year, or it can be used for crisis operations. So in addition to that, we have that revenue source as well. At your next meeting, my plan is for the commission meeting next week we'll begin the bond sale process for this project. Included, I don't want to kind of have that meeting before we have that meeting, but what I will tell commissioners, what are, just as a reminder, there are costs from the transitions project and site work associated with the transitions and cottages, permanent supportive housing that the county has cash financed to this point. That will also need to be debt financed as well in this project cost for the debt. We generally do not debt finance our FF&E. So the numbers you'll see next week are going to look a little bit different than this 10.4 million because our plan, I will tell you right now, my plan is to use approximately $2 million in cash that is already set aside in that mental health sales tax fund to pay for the owner's FF&E costs and to cover any contingencies that might be spent, and then to debt finance the remainder of the project. Because I don't know that this commission we haven't done a bond sale here since 2013. So there's a number of steps involved in a bond sale. So we'll start that process next week, and then it will continue to go through the actual bond sale, which will happen in mid-November. And we'll outline each of those, the specific cash amounts that we're using at that time, and then the specific debt amounts. Is there any specific questions that the commission might have for either Jay or the design team or the construction team or myself on this project?
Sarah, this is Commissioner Kelly. You note in the memo that revenues from the quarter-cent mental health sales tax and sales tax always, due to the pandemic, raises people's curiosity. Do you have any updates on, can you share what we're hearing about that? Are we bringing in the revenue that we thought we would bring in?
Commissioner, yeah, and I do owe you all an update, and I've been talking to Cammie about an update on sales tax projections, but we're definitely hitting our re-estimated targets that we outlined in the budget process earlier this summer in terms of what we scaled back. This quarter-cent sales tax was planned to bring in this year in 2020. I think still over $4 million. And so the debt costs associated with this will be a very small piece of that. There's certainly enough funds inside that to support the debt on the project. And that's actually a formal step that we go through in the process of issuing bonds. Outside bond counsel verifies that we have the funds sufficient to support the debt. and that we can meet our obligations for this. These will be sales tax bonds, but they have a general obligation backing from the county, from the just overall county funds as well. Does that answer your question, Commissioner Kelly?
It does. I just sort of wanted a perspective as we get ready for bond sale and as we approve this budget, that I'm not hearing from you that sales taxes have declined so much that we, may want to pause on some of our plans. I'm not sure I just want to think about that. My other question was regarding professional services and whether you think this is, and this may be a good question for Jay too, whether these professional services are in line with other county projects. Are we seeing a higher number? Do we usually think it's going to be about 10%, 10 to 15%? Was this one higher than normal? Any thoughts on that?
Maybe before Jay comments on that, just to briefly, what I would like to say is that we went through a negotiated contract price process with Trainer Architects to negotiate this rate. So that is a set number at this point. But I'll let Jay sort of answer the question about the marketplace.
Commissioners, sometimes it's hard, especially in looking at a summary budget document, which this really is. There's a lot of things kind of lumped in here together, adding up to kind of a big number at the bottom. The contract with Trainer was negotiated at 8%, which I think is very reasonable for a facility such as this in terms of leaning towards healthcare. Those are notoriously there's a lot of integration to do in terms of coordination between the various engineering trades to make sure that all the pieces are kind of laced into the project. And so that number is very, very, very reasonable for the market today. Again, I think there are a number of things lumped into owner professional services, kind of that subcategory. The biggest one being the owner contingency piece, which makes that number kind of jump real quick. It's important to, I think, in each of these to look at line items to kind of look at those numbers so that one doesn't seem to jump and get very large. There's a number of other things lumped in here. Demolition of the old school buildings that were actually where Tier 1 will go now. You'll see that's almost an $80,000 line item in this kind of summary piece. And so that's we grouped it into professional services, but no, these seems very reasonable for market and practice today.
Thank you. Commissioners, other questions?
So this is Nancy, and I don't really have any questions. I guess just a comment. In all of this, I think we haven't. Well, I would just recall how long and complicated this process has been, and how many times the folks at Trainer have had to go back to the drawing board after we thought that we were pretty far along. And so I'm sure while this number is large, they have earned, and they've earned every penny and probably more given how complicated and kind of circuitous the path was to get to where we are. I also think it's worth mentioning, kind of as a side note, that our consultants, the folks at Connects, helped check our thoughts on this facility along the way, and I think added a great deal of wisdom and kind of a good sounding board for a lot of the points where we needed to really make sure we were going in the right direction. And Bob and Sarah know more about that process than I do, but there's a whole other group of professionals very experienced in crisis centers who have helped in this past year or more to kind of back us up and make sure that every assumption about this facility would. So just want to make sure that the folks at Connects get some much deserved credit for getting us to this point as well.
There's nothing else. This is a regular agenda item, so we'll open it up for public comment. Sarah, is there anyone on in the courthouse who'd like to provide public comment on this item?
We don't have anyone here for that one.
Thanks. And Jay, if you could do me a favor and stop sharing your screen so we can see everyone's glorious face, that would be great. Jill, is there anyone online?
No, I'm not seeing anyone, but just another reminder, if you'd like to make public comment, to please use the raise your hand function.
Okay, we'll bring it up to the commission for comments or any discussion or motions or motions. I would just say this has been a long time coming, and I really appreciate all the work. If any of the public that's listening, we had a study session on this last week, so we got a few more details than just the budget. We got to see some pretty pictures and things like that, and it really is a testament to the collaboration between not only the organizations, but also the technical people who did all the work to put this together to get to this point. And it's pretty exciting. It's Patrick, we can open public comment up. It looks like Patrick Schmitz from Bert Nash, did you have some public comment?
I did. I just, and I hadn't planned on saying anything, but I just wanted to thank all of you for sticking with this project through all these twists and turns and the trials and tribulations. This is going to be such a significant piece to what we are doing here in this county. And I just so appreciative. And I know our community is going to benefit from it greatly for really decades to come. So thank you for sticking with it and sticking your neck out at times to make this happen, and sitting through countless meetings and redrafts and rewrites, and all for the benefit of the community. So thank you so very much for all of that. I'm almost in tears, actually, to be sitting here right now, and we're right here at this point. So thank you.
Thank you, Patrick. Appreciate that. Other comments?
Oh, I hadn't planned to say anything, but of course I will. We go back to 2016, which was the year that I was campaigning, and I remember sitting down and meeting with all of the leadership and the stakeholders that had already started collaborating, and this unbelievable team of people who came together and have continued to work together and have grown into this. I mean, I don't think our community will ever understand how unique this partnership is. For me to be able to have watched it from the beginning, I know a lot of them aren't here, but I want to thank everybody, and I can't name all of you. And I mean, county staff, everyone has made a huge difference, but I do have to point out Commissioner Thelman. I mean, she has been involved in everything and has really, she was one of the first people to bring this to the forefront. So it's Nancy, thank you. And thank you, everybody else. Patrick, Bob, you've been around when I've talked about, you recognize how unique this is. And I hope that someday our community realizes the blood, sweat, and tears and the amazing partnership that has gone on here to get this for our community. So thank you. And if Commissioner Thelman doesn't want to make the motion, I'll be more than happy to.
Oh, I expect Commissioner Thelman will make the motion.
I'm happy to make the motion.
That's what I thought.
And we would be remiss if we didn't thank the voters of Douglas County as well for passing, that quarter-cent sales tax and how important that is. Also, I think important to recognize that Pinckney neighborhood who has really stepped up and been engaged. And thanks to Jill Jolliker and Sarah and her team for for really reaching out to that community and working through that, because that's a big part that makes this work. There's just so many people. I expect we'll see awards in the future. I mean, as people start to really realize what an amazing project this is. And with that, we need to turn it over to Nancy and let her celebrate this moment.
Well, gosh, everybody's been really gracious, and I'll save most of my comments for the groundbreaking coming up pretty quickly. But so let me just go ahead and make this motion, and we'll make it official. I move that we approve Tier 1 Crisis Recovery Center project total project budget of $10,429,241 and authorize staff to proceed into contract negotiations and contract for a GMP construction value of $7,862,212 for construction of this facility.
Second.
Moved and seconded. All those in favor say aye.
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 Passes 3-0. That concludes our regular agenda items. Do we have any appointments, commissioners?
I'm actually working on the 2 ag seats on the Food Policy Council and possibly a Fair Board appointment switch. So I'll hope to have those done next week.
Okay. And then there were Megan Poindexter from the Senior Resource Center had contacted me about 2 of their board members who were interested in being reappointed. So I'd like to go ahead and do that. I'd like to move to reappoint Rosemary, I think it's Chapin, to the Senior Resource Center. Does that need a second?
I'll go ahead and second that. Moved and seconded. All those in favor say aye.
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 And then she also asked that Mary Kay Digby, so I moved to approve Mary Kay Digby be reappointed to the Senior Resource Center Board.
Second.
Second.
All those in favor say aye.
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 Then hopefully there will be 1 or 2 more in the next week or 2, and we'll get these cleaned up.
Thank you, Commissioner Druso. Any other appointments? Okay. So we will move to general public comment. General public comment is at the end of each meeting with a limit of 1 comment per person. The commission reserves the right to place a time limit of 3 minutes per speaker if desired. Individuals may not give unused time to other speakers. As a general practice, the commission will not discuss or debate, nor will the commission make decisions on the items presented during this time. Rather, they will refer to the items to staff or follow up if necessary. All comments should be directed to the county commission. Sarah, is there anyone at the courthouse who would like to provide general public comment?
We don't have anyone here for that.
Thank you. Jill or anyone online, just go ahead and raise your hand if you have public comment.
Not seeing anyone.
Okay. All right, we'll close general public comment and move to Commissioner and Administrator Miscellaneous. Sarah, you have your weekly memo there for us?
Yes, thanks, commissioners. Lots of, first, before I jump into it, I want to say, so today was the first day of advanced voting at the courthouse. I think we had record numbers here today and in the other locations. I know I'm hoping to get an update from our County Clerk, Jamie Shue, for you all, just to help spread the information about voting this fall and have some of that information for you and for him to share some good news in terms of how we're making that progress. There's a number of schedule items in here, including the groundbreaking for the Crisis Center event that we just approved today, as well as the into November, the ribbon cuttings and the Van Gogh mural unveiling. So please make sure those items are on your calendar. And that, I want to say, so later towards the bottom, we've had some updates towards the work sessions. I know next week we had hoped to have a work session on cluster development. Planning and zoning staff, we've had some vacancy, or I should say some vacant. We've had some folks out of the office recently, and so they're running a little behind, and they've asked to have that moved. I will probably put it on a regular agenda for, so it'll be a discussion item with no action necessarily, but we'll get that coming up here pretty soon. So I think Tanya and I talked about having that on November 4th. And then just so I wanted you to see there what we have planned for the rest of October and November, and then we're filling up December too as well. So I stand for any questions the commissioners might have. I know Commissioner Giarrusso is working on scheduling, working on some dates on a work session too. So I want to make sure I've got that too as well.
I just want to draw commissioners' attention to the first item on the scheduled items, which is the Wakarusa Riverbank Restoration Project. I received, Kim Billimer sent me an email inviting us to attend. I'm unfortunately not able to attend. I don't know if other commissioners are interested or able to attend. So I just wanted to draw your attention to that one.
I'll be able to attend that.
I'm trying to rearrange something, so I'm not sure yet if I'll be able to attend.
And then I think all four of the other items will all be at. So any other miscellaneous items, commissioners?
I guess I would just add, this seems kind of random and a little awfully late in coming, but if y'all will remember last year, a few of us worked on a farm stress presentation for Humanities Kansas, which is a statewide speakers bureau basically. And so Carrie Britt and Mallory Meeks with Extension and Dr. Brad Dirks and Steve, the director of headquarters, got together, created a video, now have a panel put together. And we're doing our first panel presentation on Monday in Onega, Kansas. I have to say that the leader there has a wonderful job. She has 3 behavioral health, local folks coming to make sure that there are local helpers available if in case any kind of issues are stirred up, and for kind of follow-up mental first aid training, all that kind of stuff. So we're excited to get to Onega and have our first panel and socially distance and all of that. But I'm just really grateful for Carrie's help and Mallory's help in getting that done. And grateful to Humanities Kansas for the opportunity, because with COVID-19, man, the farm stress it's always high, but it's got another layer added to it this year. Thanks.
Great. I'll look forward to hearing how that goes. Give us an update next week.
Any other commissioner item? I'll share with the commission and the public a little bit. We have a lot of news to celebrate recently when it comes to economic development. I think we all heard about Pretzels Inc. coming, and I think that's, we all benefit from that growth, and sometimes we may not see it that way, but in a time when we're really concerned about our tax base and what we'll be able to do and how we'll be able to support our community, that is certainly a celebration that they're interested in coming. I shared with Sarah, we continue to have discussions at the the Incentives Review Committee about the roles of the county representatives and the school board representatives, and the fact that there is no city representative on that. So I think Sarah will be visiting with us in the future about what our recommendation is as we move forward in that, and what we would like to do and how we would like that to go forward. It makes it a little tricky, as I've explained to commissioners before, and I'm sure you understand, to have 1/3 of our body making a recommendation before it ever comes to our body. So, and then the last thing I would share is I got to watch the guest speaker at the study session for the city commission last night. If you haven't had a chance, you might want to go back and watch that. It's quite interesting. I think I appreciated him coming. He had a little different perspective being in Wichita, and made some generalizations about county and city relations that I'm not sure are necessarily true for Lawrence, Kansas and Douglas County. But I think it's just some interesting perspectives, and it was one person's opinion, one professor's opinion. And I think as we think about our city and county relations, I will echo what Commissioner Boley said. I think they have really improved with unified command and with the leadership that Sarah and Craig Owens have provided. We still have a ways to go, but if you have time to watch that video, you might want to do that. So just share that. Any other items, commissioners?
I'll add one more, as long as we're, it's pretty important. Tomorrow is kind of the major public announcement, and I think groundbreaking as well, for phase 3 of the BTBC, the Biotech and Business Center on the West Campus at KU. And some dignitaries like our governor and several other high-level leaders in the state, as well as the chancellor and a number of local folks. It's a limited number of folks who get to participate, but it's going to be live streamed on their Facebook. So it's really an important event, and it's a really remarkable advancement of that biotech industry, the research side of the industry that is growing phenomenally well and rapidly, and performing above all of our projections. So this third building, that I'm sure it'll make the news, all of the very interesting and very generous funding streams that are making it possible. It'll really be a great celebration, a lot of progress. So Sarah, are you going to be there tomorrow? So it'll be good to be part of that.
Yes, I'll be attending too.
One last thing that I just want to draw the commission's attention to and the public's attention to. Douglas County government on their webpage now has a race and equity tab. And I know Jill's on this call, and I don't mean to put Jill on the spot, but that is new for us. And I think it is, for me, it's certainly a celebration. I think that's something that we have talked about quite a bit. And you see on their core beliefs, and then the organizations that are focused on that area. Jill, do you mind just sharing a little bit about that?
Sure. Well, those core beliefs are largely, the starting point we used for those are the ones that they come from GARE, the Government Alliance for Race and Equity. And since, we really just started doing this work, those were easy to gravitate to, not just because it was easy, but also because they're just good and they resonated with everybody in our work team. So our work team, just real quickly, our internal work team includes myself, Mike Brower, the Criminal Justice Coordinator, Carrie Britt, our communications manager for the county, our HR Director, Michelle Spreer, Jasmine Moore, the Sustainability Director, and our most recent kind of a guest addition in the spirit of collaboration is Casey Toomey, the assistant city manager for the city of Lawrence. I envision that their new director of diversity and equity inclusion will be joining us as well, because we can learn from each other. We're both members of GARE. And so we have a great group, Commissioner, I left, I know I was leaving some people off. Charles Branson, the district attorney, is a member, and as well as Hannah Whitman, who's one of the assistant district attorneys in the DA's office as well. We've talked really recently about the upcoming training that GARE is going to be facilitating on advancing racial equity and the role of local government. That we've got up to 65 people, city, county stakeholders, community members that are going to be doing that in December. That the DA's office is helping facilitate, but it really will be a broader group of invitees than just members of CJCC. We hope to have department heads and some of our other elected officials from the city and the county, community members from the equity group that's been meeting in relation to COVID-19 and before COVID-19. So we're looking at internal things, we're looking at external external things as well, trying to be mindful of. We share what we're working on individually, and we share opportunities to have impact collectively. And we meet monthly and hope to guide efforts in a meaningful way moving forward.
Thanks, Jill. I appreciate that. I put you on the spot there a little bit. You didn't know you were making that short presentation, but I just wanted to draw the public's attention to it. It's a big step for us, and I really appreciate it.
Yeah.
Anything else, commissioners? Okay, with that, we are adjourned.
Take care, everybody.
See you later.